Beacon Charitable Pharmacy has existed for about 19 years. When we first opened, there was not a charitable pharmacy law in Ohio. But once that law passed in 2006, we got busy trying to prepare to open a charitable pharmacy. And our pharmacy here opened in 2009.
It's very important and very unique to have a pharmacy like Beacon Charitable Pharmacy in this community. Most communities across Ohio and even across the country do not have a charitable pharmacy where someone who is unable to afford their medication or uninsured and underinsured is really what Beacon targets. And the opportunity to get medication to people in that situation is very unique and very powerful.
Beacon has been probably the most far-reaching grantee that Austin Bailey has because of all the wonderful work they have done with prescription drugs.
Beacon Charitable Pharmacy has served thousands of clients over the years, and they have built trust among the clients. And they provide education to the clients about how to manage chronic diseases, how to manage their medications, and it makes perfect sense for them to also provide COVID-19 shots.
I think one of the biggest factors is trust in relationship to the COVID vaccine. I believe that we have established a reputation that we could be trusted. We've worked with a number of populations, and we've been mobile, and we've gone out to the areas where they live and where they worship and where they maybe get their services, predominantly get their service. I believe that with the information that we give them about the vaccines, and we are not interested in vaccinating anybody that is not wanting to get vaccinated, but we're willing to provide information, and if they choose to get vaccinated, we certainly are ready to do that.
When I first started going out in the community, there was some negative talk, but the more you go to a facility and you see the same faces over and over, they do have a change of heart, and you talk to them about the benefits of having a vaccine.
We have a partnership with St. Anthony, who has a very active and wonderful Latino ministry.
It's been very pleasant working with the Beacon Pharmacy once the pandemic began, and it was time to get people moving into getting vaccines. Whenever there was a need or an opportunity to send somebody here for that, they were very open to doing that. But it really served our community much better when Heidi was willing to, in a sense, bring the Beacon Pharmacy to our church.
When I met Heidi, and she explained all of the things that they offer for the community. Right now it's important because before I don't know anything about Beacon Pharmacy. I know about the pharmacy that was in Goodwill, that's it. But after I met Heidi is when I realized all of the services that they have over here.
Our staff is very good at talking to people in terms of, it's in their time. And if they want to sit a little bit and talk, ask questions, observe what we're doing with others, we're very open to that.
Most of the time, whenever our patients come in, not only do we talk about healthcare, we kind of talk about their self in general. So, looking at both their healthcare, but them as a whole person. A lot of them, they come in, they don't have the greatest support at home, so we're able to be kind of that extra support and that safety net for them as well. So being able to sit down and have that one-on-one conversations, it means a lot to us as healthcare providers, as well as to our patients who really love that.
The question that most people ask the most is the side effects, how they may feel after they get the shot, how long do they have to wait to take the second shot, if there's a second shot. And I just go through, like, you get the shot, your arm may be a little sore, it may have a low-grade fever.
Well, if someone's never taken the vaccine, I just think there's so many of us that have, and that's one of the things we say often at church. Look at us, we've all had it, and we're happy and healthy.
One of the things that I said to them, if you have the vaccine, you are going to be in the community more safe. And this is make you to have more interaction, social interaction, because it's going to be better for you and for your family.
First of all, it's everybody's personal choice whether or not to get a vaccine. My role as a pharmacist is not to convince people that it's the right thing to do. My role is to answer their questions, make them feel comfortable with a decision that could very well save their life or the life of someone else.
We truly want people to have the right to choose, but we believe that vaccinations can help all of us to prevent ourselves from getting COVID, or if we do unfortunately get COVID, perhaps we will not get it as severely as others might that are not vaccinated. And the hospitalization rate and death is pretty minimal.